pessoal de saúde, e mostra ia rasica, buka rasica através do Facebook, rono-se TVTL, rono-se rádio, se sanse nebe, e tá contente até teves, Covid obriga ita para ver logo Facebook para ver tá, a notícia para ver tá, e nós comunidade se mesmo que se recebe de aldeia, se suficiente pessoal de saúde se tumba foi informação e nós ia ligar e me nota careta ser tamo sair o autoplante será anúncio onde sai da tabela adotamos Covid-19. Pronto, onde sai tabela tem uma ida é Covid ou tudo tem será ita tem uma Covid-19 e a cota ela precisa levar só vai lutar será tem os sintomas da mesma que é uma sofre tanto nos metem a por mora de semana etc. Quer dizer vou dizer que é fácil será tu compreende será ter e mantém logo quando ia início logo quase lo vai centro integrado sempre lá frente situação e gostei de lá ver a facilmente quando quer matar por exemplo tem que dar uma certa informação sempre todo o da comunidade. Pronto, em termos de sintomas, será muito bem, nessa aldeia. E hoje nós a transmissão das comunidades será que a gente pode ser se não já tem que mora sem transmite a minha barca, lá esteve e a gente diria que está lá vírus que quando teve ou seja que a apresentação do doutor Afonso só houve teste molecular e foi para detectar Covid-19 e só há o PCR e foi lá tem mas já o microscópio mas lá só bater e teve o microscópio. Pronto, em termos de um insight da tudo para ver e se o doutor atende que é o praticamente será ralo nessa vai e tem que evita la carne ma com ema né usi como dar se não opinião nós não marcamos opinião a bater então tem a distância social né depois interessante era ser a roupa de centro integrado de serviço será GABA ou é que será GABA deve ter nós tem que ter GABA e também governo eletrônico mesmo situação é difícil nelar, mas ele consegue dar o serviço que ele protege a população. Mesmo que lá todo balo tem que fila para ter a fila, mas no entanto ele trabalha. Pronto, só para atender hoje só será que tem informação balo de ameaças no Facebook. Essa mídia será bem você televisão, você tem autoridade, será pessoal de saúde, será e lembra que fontes de mesmo que será informação para o Covid-19. Internet ser minha opinião, ou então será o governo em intervenção para responder ao Covid-19, a maioria será dia que temos, o governo algum dia que consegue travar a transmissão, e será nós comenda, porque será acaba de comenda do Ministro of Health and the frontline workers for the work that they have done. Será apreciado até o serviço na mesma que o Ministério da Saúde, nós temos a linha frente ser halo e o serviço trava a transmissão do Covid-19. Pronto, a mim nós não se ser na opinião também, que sempre é uma tampa ilegal e também mal, e ter a primo ser a mamar ser na mesma que pensa até gosta hacker da fronteira será nem perigo talvez, também mas que tudo dia opinião que dia que eu tenho controle na fronteira do dia, não nós e tem portos de entradas tanto terrestres, tanto táxi, tanto aeroporto tem controle dia para e também trava vírus né, porque tudo tinha compreensão de que até moras importado, lá o Timor, mas veio quando eles lá em mais. Então, o trabalho tem que estar na fronteira com pronto, se nós entendemos que estamos a governo aplica estado de emergência, compreende que tem limite liberdade da população em ser em atividade de movimentação, mas isso é importante para ter trava mora sira. Pronto, parte segunda. Ali se pode. 5 minutos está bom. Pronto, o tudo nem a tudo ser mas ser ralo individualmente, em medida. Esse é o tudo da ralo saiba o tem facilima, a tam fala mais tem facilima, lá tem usa máscara fazer o tudo ralo ser mas que Covid ralo cuidado ralo. Quando facilima mas será interessante itu quando se dá Covid se dá muito será pode kita facilima mas lá os regulares, quando está cara também não fácil. E não tem a diferença mais quando o primeiro governo aplica estado de emergência de primeiro, strict é muito de cumprir. Mas vai do segundo, terceiro, começa a não cumprir, não temos dar esse trânsito. Então, será mais a retuir essa sanção, né? Se tem comportamento, mas lá o treino nessa cena ainda cá, que é para o facilitar. Olha, a começa a latar máscara lá na estrada, portanto, lá apresentar máscara lá na estrada. Por exemplo. Pronto, não é facilima da quarentena. Quando vai hand sanitizer, a mim nunca usa, a mim possam lá a pessoa. E é bom quando vai ser lá, eu look a pessoa de saúde dizer não vai marcar, a mim sim, mas a usa o tono agora não são lá a pessoa sabe. Quer dizer, tudo que tem dependência tem que botar tem que se governo preparar, mas por bater que custa então, mas nem facilima mais fácil do que usa hand sanitizer. Pronto, quando vai usar máscara, o doutor dia que só ia balma, se não é mesmo lá pergunta, deve ser nessa aí quando usa máscara, da isso usar ritual, então ainda não é mais desincentiva a usar máscara. Pronto, quando vai a social distance, será prática, mas a minha estudo coincide logo só em uma faixa de 200 horas. Então, eu falo, se a água pode ser capaz de autoridade ser tal, pode nessa ida tal, um metro, mas aí a bala será controlada. Então, é um metro, se a bala uma aplica, bala lá aplica. Pronto, os somos hoje nessa vai, hoje já é uma fã aqui, tu pode fã que sai do meio da água, você pode amanhã nessa manhã, tem que tacar o tixo ou tacar o município, e não é mais que siradeia e sirahalo. A mim, os somos, se querem quando Covid lá os problemas na prática de ser pode ser ele continua lá. Siradeia facilima que ele se continua na dia coisa. Mas bem ida lá bem cair lima não é lá os tem cultura lá com malo lá nem malo talvez ele lá bem continua porque ele lá os tem cultura. Mas facilima me sente que é importante para ele continuar porque dia coisa tem saúde nós prevene de os Covid-19 mas bem eu sim mora sentar. Pronto, essa é a sugestão para todo dia que tem serviço dia e se iramos na zona amiga porque o governo sendo mas era frontline, mas era sim subsídio, então na zona autoridade se lá cima, se por ser galera, será pago um serviço bancário, a minha organiza a comunidade, a pessoa que se ele não é uma frontline, mas será a missão lá ao serviço, pronto, em termos de discriminação ou parece que o governo na zona força se dá troca de ser social de ser, parece agora que ela chegou e ela tem põe mão a presidente da sexta base, mas que talvez ele viagem, se ele perdia para a viagem também, e a se submete ao Centro de Gestão Integral de Crise, e nós tenta atuar publicar e o científico. Obrigado, Barato.
Okay, kalau kami sudah masuk ke kita se pasa itanya tempo vamos dar segundo antes de pasar a la auxiliar
Bem mais
auxiliar biografia si orador segundo dunia how correct how usa língua inglesa dele. Okay. Dr. Dong Hao Yu is the medical officer, epidemiologic, and officer in charge of WHO country office in Timor-Leste. He has been working in different offices of WHO, including WHO Regional Office for Western Pacific and Southeast Asia, covering surveillance and health emergency preparedness and responses. He holds a doctoral of public health degree in epidemiology from the University of the Philippines, Manila. He has published extensively in peer-reviewed journals in the areas of public health, epidemiology, surveillance, health policy, and development, among others. Currently, he is working to support the COVID-19 responses and strengthen the health security in Timor-Leste.
Obrigado, MC, and good morning, bon dia. So, it is a great honor to be invited to this very distinguished panelists to talk about the COVID-19 and so most of the people here are from the socio-economic sectors and engineering. So maybe I, after listening to the famous professor, Professor John, your presentation, I think maybe people, I'm not sure whether we are so much interested to the COVID, which we have been talking for more than 2 years, almost 2 years. So as MC just introduced, I'm Dr. Dong Bao from WHO Country Office here. So actually I'm the medical officer, so but the officer in charge currently as our WHO representative, Dr. Arvin, is not here. So very unfortunately, he is a very good speaker actually. So you have to tolerate with not very good speaker for this presentation. So I think the topic by the organizer is beyond vaccination, social distance, the use of masks, hand sanitizer. What should Timor-Leste do in terms of health in the future? New normal. I didn't change anything for the title. I just take the whole topic provided by the organizer for this presentation. I think maybe the organizer doesn't want me to talk anything about vaccination, about hand sanitizer, using of masks, after we are talking this for almost 2 years. Okay, next please. So this is my presentation, very simple, current situation in Timor-Leste. So what are the possible future scenarios for the COVID pandemic in this country, and also what should Timor-Leste do? So what I'm going to talk is exactly what the organizer wants me to do, but I'm not sure whether I can do the good job. So regarding the current situation, next please. So as you can see here, it's almost 2 years since the start of the pandemic. So I remember last year in January, I just came back from my annual leave in Hubei, not in Hubei, actually from Fulan. It's a neighboring province of Wuhan. It's just 250 kilometers. When I take the leave, I realized the situation was really bad. So I cut short of my leave and take the next flight and come back to Timor-Leste. So at that time, the situation was very, people are very tense. So whenever I go to the street, whenever I went to the street, people will always follow me and say, China virus, China virus, China. So I know they are talking about me and the China virus. And after almost 2 years So the situation has changed so much. So now we are in the second year, almost finished the second year of the pandemic. And as you can see, the pandemic we have gone through in Timor-Leste so-called 3 waves. But actually, some people said we don't have the first wave. In the first year of 2020, until March of 2021, so we have seen rising of the cases dramatically. First, through the border area screening in Suai, in Maniana, and also in some of the cities, sukus here in Dini. So we have seen. So almost the first year we don't have many cases, only sporadic, about 40 cases until March of 2021. So now, as you can see, please the previous one, please. So you can see that there are 2 major waves after March. And March and April until May, finished the first wave or the second wave, some people say. And then in late July until August, so we have seen the second major wave, which is really big. So some days we have seen more than 500, 600 cases tested, reported. So in a small country like Timor-Leste, that's equivalent to 100,000, 200,000 in India and China, you just imagine, okay? So now, the second wave we consider is almost over. The third wave, the current wave. So we have only, on average, about 5 cases per day, and sometimes 0. You have seen that in the past weeks, we have 2 days there were 0 cases reported. So we have a small number of cases currently. So people may argue that the current wave is still there, but we may consider this is the over of the current wave. So next page. So this is the number of deaths. The number of deaths is, I think it's overlapping with the number of new cases, as you can see. So actually, the first reported deaths in Timor-Leste is March 28th. So after that, we have seen until now, cumulatively, we have about 120 deaths overall. But however, you might argue that there is a significant underreporting. As we can see, anecdote evidence or reports from the community there, large number of people die because of the symptoms similar to what COVID, but people are so scared to go to report to go to the healthcare facility because of the fear, because of the stigma related to all the government measures, so that might be underreporting. So this is the number of cases distributed across the country. As you can see, 2/3 of the reported cases are from Dini, basically. So, and then all the other municipalities, basically after March, they have started to report new cases. So we have Dini, about 2/3 of about the 2,000 cases, and then we have the other like Bacau, we have the second largest number reported. We also have Amera, Bobanaro, and Kawanima. So basically those areas bordering Indonesia, they have reported most of the cases. Next, please. So if you see, this is what are the age structure and the sex distribution of the cases and the deaths. You will see, if you see the cases, most of the cases are reported among the 20 to 40 years age group. Those age group composite the biggest number of new cases. However, if you see the number of the deaths, and the most of those death cases are among the older people. So this is generally the global trend. And the male accounts for more than the female. among the deaths and also among the cases. But generally, it's a little bit similar. Okay, so next page. So if you see, this is the, the number of tests we have done in the past 2 years, almost 2 years. You will see we have done more than 200,000 tests over the past 2 years. So this is also significant for a country with a limited infrastructure and capacity, but we are doing quite well. And the next, the bottom slide shows the test positivity, number of tests in the past 2 weeks. You will see the yellow line at the bottom. This is an indicator where, whether we can judge whether we have significant local transmission. As you can see, currently in the past 2 weeks or 4 weeks, the test positivity really dropped down significantly, below 5%. Below 5%. So I think in the last 2 weeks, only about it's below zero. It's around 0.26 in the last week. So this is an indication where the local transmission or community transmission has been minimized. But again, people may argue whether you have enough tests. So I think this is valid because you can see the number of tests also dropped down significantly. I think during the holiday season, we test a very small number of people. So this is related to some of the topics one of the topics which I would like to mention later. Next, please. So this is just a proportion, of those deaths who are the vaccination status. You will see that majority of the cases, who die are not vaccinated or not fully vaccinated. So this is significant. So it demonstrates, as demonstrated in other places of the world, that vaccination is protect you against severe case and hospitalization and deaths. Next, please. So this is a number of vaccination up to I think up to which date? The 2nd of November. So you will not be surprised that we are not that bad, even among the global countries, because we have quite good number of vaccines available in the country, generously donated by of course WHO that COVAX facilities through the donation by Australia, by Portugal, by Japan, by Chinese government. So we are not shortage. We are not in shortage of vaccines, while most of the countries in Africa still don't have enough vaccine. Yesterday, the ambassador of Thailand talked with me. He was telling me that even in Thailand, they don't have enough vaccine. They don't have enough vaccine. We have enough vaccine. Now the matter is how to, quickly vaccinate the people, because of the manufacturers, which you understand. Especially the misinformation, disinformation, and the belief about vaccines. In Timor-Leste, many people, especially in USA, in America, Nikesa, in those areas, Ilaro, still quite low, especially for the second dose. So I think the vaccination is one of the indicators where most of the country opening up to the world. Which Professor, you were talking about economy recovery. So we have to get more people vaccinated before we can open up. Next, please. Next, please. So now people may ask, what are the future scenarios? I think, nobody can definitely answer your question, but we can, from the experience of the past. As Professor, you said that the pandemic will not be there forever. So there are several scenarios. The first one, disappear. So after 2 years, it might disappear suddenly, but I don't think this is a likely scenario. So the second is controlled well, the pandemic controlled well. If we have the enough vaccination coverage, we have still stick to some of the public health and the social measures well, you know, and then we can control well. But another scenario is, you know, after this we cannot do the job well. And then the next scenario is the pandemic will still go on. So what will be the likely scenario? So I think that most of the epidemiologists or you know, researchers globally, they are thinking we will have to coexisting with the virus for quite some time. So there will be some endemic. Endemic means those viruses will be, you know, there will be outbreaks here and there, but there will be no major epidemic or pandemic. So this is the most likely scenario. But if we are not doing it well, and then you come to the next. Next, please. So here, there are several considerations for the future scenario. The first one, you know, because of the vaccination, because of the nature infection, our population immunity will grow. So I think this is a scenario for many of the countries now. We can see the report, you know, from nature infection or vaccination in India, in New Delhi, the seroprevalence, the antibody prevalence is 92%. And in Bombay, the biggest city in India, is 95%. So you just imagine, okay, so this is the immunity. And also person-to-person context. So this is also the scenario here. So if our vaccination coverage has get to, for example, 70% for the full vaccination, and then people will say, just relax, okay? So we just, you know, gathering and the social socialization, everything will come together. So this is a likely scenario. So we might see after fully, you know, if we possibly the government is going to end the state of emergency, I think maybe possibly by this year, with 6 months. We are not sure, maybe next month. So if we end that status of emergency, and the people will have more chance to mingle, to drink together, to have the social life, you know, to go to the church. In addition, we are going to have 2 major elections next year, in March and May. So that will help the political campaign. So we are expecting some, you know, increase of the cases. What is more, you know, uncertain is the dot line on the right, that if we have a new variant, so that might, you know, totally complicate the scenario. So it might have another major outbreaks. But, you know, as again, most people say, okay, this is an unlikely scenario, a major new variant, but who knows? You see, you have seen that the report about the new variant that found the sub-variant of Delta, reported from UK, and then another one from which country, you know. But we have to be vigilant. So what should we do? No, this is a key consideration. So what we think the potential for third wave or in Timor-Leste is unlikely. That's what we, you know, during the informal discussion. This is not an official position from the government or from WHO. So, but there's still many unknowns. So it is very important we keep vigilance. Next please. So here, next one, okay. So the key determinants for the future trajectory, the epidemic curve. So population immunity, like what we have said. So the scale of infection. So the scale of nature infection, we don't know in Timor-Leste. We are trying to do the seroprevalence survey, which is underway. And by some time we can understand what are the antibody prevalence in the population. And the scale of vaccination. So we have to rapidly, you know, increase the coverage, especially, you know, the full coverage. We still have many unknowns. We don't know the duration of the protection against infection, severe disease. Because some people said after 6 months the immunity waning and you have to have the booster. Some other people said WHO still not officially support booster doses for the consideration of many factors. So the second one, of course, the determinants is the person-to-person contact and also the implementation of public health and social measures. So that's another key determinant. So also the emerging variant, which also determine the future trajectory of the pandemic. Next, please. Okay, so here is I have several slides about the future actions for Timor-Leste. The first one is regarding COVID prevention. So I think this is very important for us for the next step. So we have to have a kind of good information surveillance system. Currently, WHO is supporting our surveillance department in the ministry, also the laboratory, to focus on the surveillance of the RE, so-called RE, those symptomatic patients in the healthcare facility. So if the patient gets fever and cough, and then even some sore throat, that's so-called acute respiratory infection, we should take samples. We should test those samples to understand what are the trends of post-COVID influenza and also other viruses like RSV. And one additional important component is the sequencing, genome sequencing capacity. This is we currently don't have. So we send the samples to Australia. Once we have the samples, we send to Australia, and then they will do the sequencing for us. But this is not enough. So WHO will support the laboratory to establish this capacity. So whenever we have the samples, we will know what are the variants, what are the genome characters of the virus. So we should have a kind of serum prevalence survey to understand the immunity of the population. So both induced by vaccination and also by natural infection. So based on those information, we should have a kind of early warning system, which policymakers can, based on the information, to make informed decision about the response. Next, please. So here are some of the actions. The first one, like we said, to enhance the population immunity. So through the acceleration, especially acceleration of vaccination in the underserved area. So like in Amera, like I knew, those areas still quite low. Even though the Prime Minister, the Minister of Health, WHO representative, they went there, several times. But still, according to the feedback, there's still a lot of misconception about the vaccine. They refuse. We need to have a kind of, this whole society, especially if you have the family members, if they are senior citizens or with underlying health condition. Those people are the vulnerable population. We should get the vaccine as soon as possible. We have the vaccines, why we cannot? Okay, so the next one is manage local epidemic effectively. So we have to utilize the information. In each of the municipality, we have the rapid response team. They should be able to manage. The third one is, like what I just said, using surveillance system more effectively, using the strategic information. Also, we should prepare, still. Some people said, okay, we are okay now. No, the pandemic is still far from over. We should have the medical facility, especially critical care in Nahani, in the Veracruz, maybe Nahani should be the priority in the future. And also HMTV, the critical care capacity, whenever we have the patients, we will still have the patients, by all means. Risk communication. I think this is one of the most important areas, perhaps. So our community are not fully engaged, especially for some of the public health programs. So next several slides is talking. Can you please next, please? This is about action for health security. I will just pass by. Just to highlight this one, just before the pandemic, in 2018 and 19, we have done a very comprehensive exercise about the health security. That means to guard against the pandemic like this. So we have done a comprehensive analysis of the system, including 19 technical areas about for example, the surveillance system, the laboratory system, the food safety, the antimicrobial resistance, everything. 19 technical areas. So we come out to next page, a kind of capacity of the 19 technical area. So very unfortunately, we can see in our system, area 7 is doing a little bit better. That's immunization, routine immunization. Okay, so many of the other areas still we have the gaps. Next page. So I will not repeat those, but what I would like to highlight, according to the organizer asked me to talk about the future. The last slide. Next. The next. So what I just want to say, this is the last slide for you. So what should we do for health? Okay, for health, we have to resume our service delivery in the healthcare facility. Because of the interruption of the COVID, now we seriously interrupted. So by just implementing different strategic plans and action plans, we have for health, we have to together with the support from different partners, we have delivered so many healthcare facilities. Now it's because of the interruption of the COVID to the world, seriously, we have the National Action Plan for Health Security, we have the HIV National Action Plan, we have action plans. We have, you can say, we have to come together by the year 2025. So we only have 4 years to go, but we are the fourth largest prevalence country of TB in the world. So we have a lot of work to do. Malaria is almost eliminated, but still we have some malaria cases last year from Oikusi. So all those we have to just get back to our work, and then we start to providing our essential health service to the population. So I just want to acknowledge all the work of the Ministry of Health, the different pillars, and the WHO colleagues who have contributed to this presentation. Thank you very much.
Thank you, Dr. Brody. Dombau. Dombau. Sorry. Agora, do que sessão, né? Perguntas dari tempo. Sekarang perguntas 5. Perguntas 5.
Bom dia, Baita Roto. Obrigada para a apresentadora de Lainoa, ao Menara Mica Barreto Soares, ao Departamento de Relações Internacionais. Minha pergunta sobre post-Covid, quando post-Covid saíram acontece. Desde o sei que hoje a minha apresentação relaciona com o Covid-19, você, doutora Afonso, você explica quando vai morar lá também. Mas hoje nós apresentamos o magnífico reitor, porque quando a pesquisa nos rala, a tudo é manhã quando vai aparecer uma Covid-19. Depois que se dá liante ou colher quando vai sair da noite molesta bem rala. Mas bem a uma intervenção será bem uma coisa certa hoje né? La colher será quando vai side effect, o efeito colateral é bem maka quando é macera. How colher nessa paciente COVID e havetan COVID dalam ruang, harus sofre pada side effects nene. Side effects nene, kalau parte long term nene kahonoi afeta também a saúde e da maneira. Desde Covid moço, a cidade haré mesti parte governo, mesti parte academia atau harus discussão com a pós-universidade e mesti parte WHO orasimos, la colia que harus discussão com a side effects mesti Covid narasi. Hablar tadi kata kita ne importante kalai, tambah orang kita kuliah con sistema saúde ne, ada no tu kerja durante ne kita ya problem buat babe, orang ini como relação dengan Covid, kita balik kuliah karek box, kita ne hanasan discussão topik pertinente da karek kuliah con side effects, long term side effects para paciente Covid sih. Depois segundo comentário, kami começar saja ba lihat kolega organizador sendiri. Desde o sector mai, ohin, hawaremos a agenda, haula hare, haulnya kita malu rumah involve, hansa speaker ga, o hansa organizer ga, hansa moderador y hane bahau karene, buat tidak figura triste bebes, hansa paling Ia intenção for hamne crítica né, vai ver cara que mensagem cara, aben berua, pela voz envolve sira ia serviço chave estrada. Obrigada.
Obrigado pela oportunidade e ao respeito da mesa, ao nara completo o Paulo Assunção de Deus Soares. Usi Departamento Filosofia, Faculdade de Filosofia. A minha pergunta a todos os é pesquisa barbara kita halau, mas tu analisa kata liga bertirang itu kuliah yang Covid-19 ini. Mas liga berpirane ve ho mensaho ida delta nini problema con la delta nini bel fomos impacto também total importância de Covid-19 mas ve também tem a delta nini ida segundo tu analisa pesquisa e a Departamento de Filosofia ni kata ina saludo maita se acontece tan moras fonida ida ne soal de pesquisador sir itu auto ni hari amutu tinan salon maika espera kata saya tan moras fonida tu pesquisa filosofia ni obrigado.
Good morning. Thank you. My questions is going to be it's for the representative of WHO. I'm really concerned about the vaccination here in our country. Young from 18 years old and more, they can have the AstraZeneca. But what I see in England, they only give the young people from 18 years and more. They can only have the Pfizer or Moderna. So my question is, what would the WHO see about this issue? Thank you.
What is here? Where's the microphone?
Okay. Thank you very much. My contact name is Antonia Santos. Faculty in Medicine and Health Science. Okay, my question like this. All people in medicine, all people know vaccination.
You just speak louder.
vaccination is dangerous for them because they hear information from all media like 2 years later they will die because they get the vaccination. Because that's why they don't have 10% to get the vaccination, and they hear that some of information from media, or they say that they after 2 years later they will die. That's why they don't want to get the vaccination. And what advice that gives to our community to know, give the information for them to get the vaccination. That's why we can be reduce our public our confused to the community. On the other hand, as we know that coronavirus is the opportunist. Why I say opportunist? Because some of people that get the chronic disease like TB or diabetes, they have a treat for them to get that. That's why we not the focus today. Others other diseases, why we must focus the back to the COVID-19. That's why this is my question for this. Thank you very much.
Good morning, Dr. Yu. So I'm Lily Chen from Faculty of Social Science, Department of Political Science. So I have one question for you. Is there any strategy like to fight against the misinformation and miscommunication in the community level, especially when you guys go to do the campaign for the vaccination? Even though in your presentation, vaccination is the key to increase the community immunity. The problem is that in the community level, many people they cannot really fully understand, and there's also a lot of information prevalent in social media. So is there any strategy from the WHO or Ministry of Health to fight against the misinformation?
Desculpa, estava tempo limitado ainda não queria discussão para perguntas. Renovar tudo.
Okay. Thank you very much for those questions. I think firstly, Madam, you are asking about this question about long COVID. So this is you said the non-side effects. Actually, it's the longer-term effects of the COVID. This is one of the topics that still, under study by the scholars and the clinicians across the world. It's recognized also by WHO. Long COVID means, the longer-term effects of the COVID after the people getting COVID. There are so many reports. So now it is recognized as an important for the patients who suffer, after recovery. And also, you said you get 2 times infection. So that's a kind of, phenomenon where, about 20% of the current COVID infection, they will get 2 times or even more. So we still have many unknowns. And then I think through the efforts of all the clinicians and the scientists across the world, we will have some answers for what you said. It's a part of the non-COVID. We have it will come out with some some guidance or some guidelines. The second is regarding this Delta variant and the behavior. I think that that's for whatever Delta variant or Gamma or Epsilon in the future. I think currently what we can see, we're still using the public health and the social measures what we are talking. So the measures are the same. Even though the transmissibility, for example, of Delta variant is maybe 100 times, even 1,000 times more transmissible than the original virus, but we're still using the same. But again, we don't know in the future like what I have said, the kind of future direction of emerging of the new variant. So here, I just want to. There's some possibility that the new variant may be less harmful or even self-destructive. There was a report last week in Japan. They said that the new mutation leading the virus, self-destruction. So that's one of the reasons that the Japanese researchers, they said, is one of the reasons why Japan have a dramatic decrease of the virus. Of course, this is still, is just the opinion of those researchers. So it might go to direction of another end, more harmful, more transmissible, more virulent. But again, this is about the variant. So this is vaccination for younger age. So currently you can see what we have for the adult population, 18 years and older. We use AstraZeneca and Sinovac. So in Timor-Leste. So for those 12 to 17, so currently introduced the Pfizer vaccine, which have been recommended by WHO and also other regulatory agency like CDC, also recommended. So it's a safe vaccine which have been demonstrated by it's approved by recognized by WHO also. So we are not using AstraZeneca for those under 18. Please be sure. So regarding this vaccine rumors, this I just like to remind you, when those community members they cite some of the misinformation or incorrect statement about the vaccine, you should always ask them, where did you get the information? Do you believe the source of the information? Do you believe WHO? Do you believe the government of Timor-Leste? So we are providing the vaccines for the people, which will kill the people ultimately. Is that the case? So I think this, of course, you can also, if they are more knowledgeable, we can talk about the history of humankind in fighting against infectious disease. Vaccination is the biggest weapon. It's the most successful weapon for the human history, which we can see polio elimination, and then other disease, infectious disease control. All use the vaccination, right? Do they have any evidence that our vaccine will kill the people by 2 or 3 years? So I think we should ask them. And for the question regarding this strategy of RCCE, what we call risk communication and community engagement.